abdomen. Assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. The physical examination of the abdomen is the key step in the evaluation of abdominal complaints such as pain, distension, enlarged organs, or masses. First, review client's previous medical records and doctor's order sheet if available to know if the patient undergo previous medical treatment and have a short health background. Prior to the conduct of the procedure, first thing to do is that review the client's previous medical records if available. Then, determine the scope of the assessment needed, prepare necessary equipment to know the extent of the physical assessment and to conserve time and energy. The equipment that I'm going to use includes tape measure to measure the patient's abdominal girth, stethoscope to listen for the patient's bowel sounds, gloves to protect myself from infection and microorganisms. Perform hand washing, don gloves if deemed necessary to protect my patient and myself from infection and cross-contamination. As you can see, I'm already wearing my sterile gloves to be ready for the assessment. Greeted the client politely and the client's companion if around. Introduce self and verify the client's identity. Ask how the client would like to be called during the assessment. Establish rapport with the client. To have respect to the patient and so that the patient will know who's assessing them and what name they are comfortable to be called during the assessment. Good morning, sir. I am Keisha Nuevo, your student nurse for today. May I see your wristband, please? Please state your complete name and birthday, please. Okay, and how would you like me to call you, sir? Okay, Holland. Explain the procedure to the client and how he or she can participate during the assessment, provided the client the opportunity to clarify or ask or any concern, so that the patient will know what will be conducted to them and to address their queries and other concerns. So, okay, Holland, today I'll be assessing your abdomen, which means I will be exposing the part of your abdomen in here, okay? And I'll have to listen for your bowel sounds and also feel your internal organs. Will that be alright to you? Okay, Holland, do you have any concerns or clarifications? Okay. Ensure client's comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secured, and free from distraction. Position the client to be seated comfortably in a woman, drape the anterior thorax when it's not being examined, so that no one from outside can disturb during the assessment and all of the information will be kept confidential. Will be that alright if I already close the door and the curtain so that no one can disturb us during the assessment? And also to ensure the privacy, okay? Okay, so before we start, I encourage you to void first so that so much more you will be comfortable for you while doing the assessment. Okay. Ensure the client has emptied his or her bladder. If a full bladder can make the examination uncomfortable and it can be reduced the bundle height measurement. So, okay, do you want to pee before doing the assessment?
No.
Okay. Surveying the abdomen. Position the client in a supine position. This is to have an easy access in the abdomen. Okay, as you can see, Holland Carl is already lying in the bed in this supine position. Cover the upper and the lower part off with the bed sheet, leaving the abdomen exposed. To ready the abdomen for the assessment and cover the parts of the body for the patient's privacy. Okay, Holland, I will be going to expose your abdomen and is it okay to you? But wait, do you feel any pain in your abdomen?
No.
Okay, so now I'll be inspecting your abdomen first, okay? Okay. Observe the abdominal skin. Noted for any vascularity, visible dilated veins, example spider veins, to know if the abdominal skin of the patient has vascularity. Noted for any stray or what we call stretch mark, to know if the patient abdomen is a presence of a stretch marks. Okay. Assess for scars, to assess if there is a scar on the patient's abdomen. Note the history of scars and document its location by quadrant reference lines. If there is any, then note the history of the scars and where it is located of it. Assess for lesions and rashes, to know if the abdomen of the patient has rashes and lesions. So next, inspected the umbilicus for its color, to know if there are some unnecessary color in the umbilicus. Contour. The contour of the abdomen can vary. The umbilicus is the midline in a teen individuals. The epigastric pulsation in the occasional gentle peristalalis may be visible. And their location. The normal umbilical position is at 60% of the way from the inferior border of the cipesternum to the superior border of the pubis in the midline. Okay? The umbilical skin tones is similar to the surrounding skin tones or even pinkish. It should be recessed or inverted or protruding no more than 0.5 centimeters and it should be round and conical. Examining the abdomen. Inspection. Inspected contour for round, flat, or extended. While the client lies flat supine on the bed, sat beside the client and look across the abdomen at a level slightly higher than the client's abdomen to know if the abdomen of the patient is flat, rounded, extended, and the abdomen should be evenly rounded. So the abdomen normally flat, rounded, or scaphoid, which is normally seen in a thin body, and it should be evenly rounded and symmetrical. Inspected the abdominal girth. Inspected the area in between the lower ribs and the pubic bone and noted for any abdominal enlargement. To know if the abdomen of the patient has some abdominal enlargement. Measure the abdominal girth using a measuring tape at the same time of the daily, ideally in the morning. To evaluate if there is abdominal distension of the patient. Measure the patient's abdominal girth by placing measuring tape around the patient's abdomen at the level of the umbilicus so that the abdominal girth should be measured at the same time of daily, ideally in the morning just after voiding. So your abdominal girth is at 27 inch, okay? Ensure the client has emptied his or her bladder to prevent discomfort. So, okay, do you want to be? Okay. Position the client in a standing or supine position. Client's head may slightly elevated for orthopenic patients. This is the one of good position in assessing the patient's abdomen. As you can see, the patient is already in a supine position. Okay, hold on. Are you comfortable with your position? Okay. Use a disposable silicone tape measure if a tape measure is not available. Use a strip of cloth or gauze, then measure the gauze with a cloth tape measure or yardstick to measure the abdomen of the patient. Place the tape measure behind the client and measure starting on the umbilicus to know the measurement of the abdomen of the patient. Record the distance on the distance on designated units, centimeters or inches, to add it for the summarization of the assessment. Take all the future measurements from the same location, especially for noted distension, to know if all the measurement is normal and note for any distension. Mark the abdomen with a ballpoint pen and 8 in measuring sign to mark the reminder that is in that area as a presence of distension. So if I will see in your abdomen that there is a distension, it will be not okay if I will mark it with the using of ballpoint pen. Okay. Ask the client not to wash the mark off until it's no longer needed, so that the client will be aware that he or she need to wash it if the assessment is already done. So, as you can see, I put mark here, and please don't raise it if the assessment is already done, okay? Check for symmetry. Ask the client to raise his or her head to further assess for the herniation or the SPs. Example, bulge. To assess if there is a presence of herniation or the SPs. Okay, can you please repeat this? Okay. Inspect the abdominal movement when the client breathes to assess if the patient will breathe, there is any abnormal movement of the abdominal. Okay, can you inhale and exhale, please? Inhale, exhale, again, exhale. Okay. Observe the peristaltic waves. Peristaltic waves generally do not propagate along the entire intestine but instead propel the chine only a few tenths of centimeters. Auscultation. Auscultated for vowel sounds. Use the diaphragm of the stethoscope and make sure that it is warm before placing the abdomen. The diaphragm of the stethoscope is the best used for the high-pitched sounds such as breathe, vowel, and normal heart sounds. Apply light pressure or simple rest in the stethoscope if the abdomen is tender or painful, to know if the abdomen of the patient is tender or painful. So the stethoscope sounds hard. Okay, I'm gonna put in some light pressure on your abdomen and please tell me if it is painful. Okay? Okay. Here. 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 Perform auscultation starting with the right lower quadrant then clockwise. The vowel sounds may be more active in the iliobuccal ball in. Listen to each quadrant for 5 minutes, minimum of 1 minute per quadrant to confirm the absence of the vowel sounds. To assess and confirm the presence of the vowel sounds. Note the intensity, pitch, and frequency of the sounds. To add it in summarizing all the results and the patient will be able to know it. Auscultated for vascular sounds. Use the bell of the stethoscope to listen for the broods. Low-pitched murmur-like sounds pronounced over the abdominal aorta, renal, iliac, and femoral arteries. The bell of the stethoscope is the best for picking up broods. venous hum. Use the bell of the stethoscope to listen for venous hum in the epigastric and the umbilical areas to know if the venous hum, epigastric, and the umbilical areas have abnormal sounds. Auscultated for friction rub over the liver and the spleen. Place the diaphragm of the stethoscope over the right and the left lower rib cage and listen for any friction rub to hear if there is a presence of friction rub. So next, percussion. Percuss for tone. With the percussion hand technique, lightly systematically percuss all the quadrants. Percussion may proceed clockwise or up and down over the abdomen. To know if there is presence of generalized symphony that is predominates over the abdomen, and if the liver and spleen has abnormal dullness. Percuss the span of the height of the liver by determining its lower and upper border. Determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards to this location of the ileocal valve. Noted the changes from tympany to dullness. To have a record in it for the summarization of the assessment. Mark the area of the dullness. This is the liver border of the dullness. To have the site where are the areas has the presence of dullness. Assess the descent of the liver. Located the liver border of dullness so that you already know first before starting the assessment. Ask the client to take deep breath, observe the descent of the lower border of the liver dullness below the costal margin, and deep inspiration in the client hold his or her breath to be able to assess the dullness of the lower border of the liver below the costal margin. Perform percussion and ask the client to exhale afterwards. Start the assessment and have result. Okay, hold on. Please breathe in and hold it for me. Percuss the upper border of the liver, located at the upper right chest of the midclavicular line and percuss downward. To know it before starting to percuss at the midclavicular line and downward. Mark the point where change from the upper right chest lung resonance until liver is dullness noted. This is the upper border of liver dullness. To have a sign that that area has a presence of dullness. Okay, hold on. I'm going to start percussing. Measure the distance between the two marks. This is the liver span. To know the measurement of the liver span, stated the percussion of liver at the mid-sternal line or MSL to assess the mid-sternal line and found what is needed. But first, I'm gonna measure the distance between the two marks and to know the liver span. Percuss the spleen. Begin the percussion on the posterior to the left mid-axillary line and percuss downward to assess some abnormal findings in the left mid-axillary line. Noted the changes from lung resonance to splenic dullness. To record it and tell the patient about the results in summarization. Okay, hold on. I need you to move your body to the left. Perform a second method of percussion to determine the enlargement by asking the client to take a deep breath and start percussing on the left interspace and anterior axillary line to know if there is a presence of tympany. Blunt percussion on liver. Ask the client to sit with his or her back to you to position the client properly in assessing the liver. Okay, can you please sit? Place the left hand fist against the lower right anterior rib cage. Use the ulnar side of the right fist and strike the left. This is the proper hand position in assessing a liver. Noted for any tenderness upon percussion to assess if there is a presence of tenderness. Blunt percussion in kidneys. Ask the client to sit with his or her back to you. This is the proper position in percussing the kidney. Place the left hand on the contravertebral angles. This is the proper position of the hand on the contovertebral angles. Repeated steps 47 to 48 to complete the assessment, and the procedure also still the same. Okay. Tested for abdominal distension, bulging flanks, or asties. Percast the flanks from the bed upward toward the umbilicus to assess what are some abnormalities from flanks towards the umbilicus. Noted for changes for dullness to tympani and mark this point. To record it and tell the patient in summarization of the results and have a sign that in that area has a dullness to tympani. Then, I'm going to start the assessment. Assist the client to turn into the side to be able to position the client properly to start the percussion. Percuss the abdomen from the bed upward to know some abnormalities. Mark the level where dullness changes to tympani. To have a sign about a certain area as a dullness that change into tympani. Perform fluid wave test. Ask the client to place the ulnar side of his or her hand and lateral side of her forearm firmly along the midline of the abdomen. This will deter the movement of your thumb across the patient's skin. Only fluid will move if present. Okay, firmly place the palmar surface of fingers in hand of nurse against one side of the client abdomen. This is to start the assessment of the patient's abdomen. Use the other hand to tap the opposite side of the abdominal wall. This is to tap the opposite side of the abdominal wall. Noted for any fluid movement. To have a record about the result of the assessment performed. Okay, then these were kind of. So now, let's proceed to palpation. Position the client back in the supine position so that it is to assess the abdomen of the patient. Cover the upper and the lower part with a bed sheet, leaving the abdomen exposed, so that some parts of the body will kept confidential, and so that we have an easy access of the abdomen. So as you can see, it's already covered, and the abdomen of my patient is already exposed. Began palpating on a non-tender abdominal quadrant to assess if there is any presence of non-tender abdominal quadrant. Use fingertips to compress the quadrant to a depth of 1 centimeter in a dipping motion. This is to palpate the area needed to be palpated. Lift the fingers gently and proceed to the next quadrant to be able to palpate the other quadrant and assess it. Began palpating deeply all quadrants to delineate organs to assess if there are some abnormal findings in quadrants to delineate organs. Use the palmar surface of the fingers to compress the quadrants to a maximum depth of 5 to 6 cm. This is to palpate the abdomen of the patient and compress it. Noted for any resistance or any deeper structures to record it and tell the patient in the summarization all the results. Perform by manual palpation of the resistance or deeper structure is felt. To determine more assessment, but it's only performed when it's felt. Okay, hold on. I'll be palpating your abdomen again. Palpated for masses. Use fingertips to compress all the quadrants to a depth of 1 centimeter in a dipping motion. This is to palpate the area needed to be palpated. Noted for any masses and its size in centimeter, location, shape, consistency, demarcation, pulsatility, tenderness, and mobility. To assess what is the size, location, shape, consistency, demarcation, pulsatility, tenderness, and mobility of masses if present. Palpated the umbilicus and its surrounding. Noted for any swelling, bulges, and masses. To assess if the umbilicus and its surroundings has a presence of swelling, bulger, and masses. So next, palpated the aorta. Use the thumb, first finger, use both hands to palpate deeply the epigastrium slightly to the left midline. To palpate if there are some abnormalities in the epigastrium to the left midline. Assess for pulsation. To assess the pulsation of the patient's aorta is normal and strong. Palpated the liver. Stood at the client's right side. This is to assess the liver of the patient's easily. Place the left under the client's back at the level of 11th and 12th ribs. To palpate if the 11th and 12th rib of the patient has abnormalities. Lay the right hand parallel to the right costal margin. The fingertip should point toward the client's head. To palpate the right costal margin of the patient. Ask the client to inhale, then compress upward and inward the fingers. To know if there are some abnormalities to the patient's right costal margin. Noted for consistency and tenderness. To record it and let the patient know the findings later. So, palpated by hooking. Stood to the right of the client's chest. For easy access of the client's right chest, Curl or hook the fingers of the both hands over the edge of the right costal margin to palpate if there are some presence of abnormalities in the right costal margin. Ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers. This is to assess if there are some presence of abnormalities during inhaling and palpating, noted for consistency and tenderness. To record if the consistency and the tenderness is normal. Okay? Test for cholangitis. Press fingertips under the liver border at the right costal margin and ask the patient to inhale deeply. This is to know if there are some abnormal findings under the liver border when palpated. Noted for the right upper quadrant pain and tenderness. This is to record the right upper quadrant of the patient has pain and tenderness. Palpated the spleen. Ask the client to turn into his or her right side to be able to start the assessment in palpating the patient's spleen. Okay, all this like this. Straight. Palpated the spleen by moving it downward and forward. This is the proper moving to assess the patient's spleen. Document the size in centimeters below the left costal margin. To have a record on it and tell the patient about it later. Noted for consistency and tenderness to record if the spleen of the patient has a presence of consistency and tenderness. Palpated the kidneys. Place left hand on the right posterior flank and provided support. This is to palpate the right posterior flank. Place the right hand on the right upper quadrant just below the costal margin at the mid-clavicular line. And this is to palpate also the right upper quadrant below the costal margin at the mid-clavicular line. Ask the client to inhale and exhale and hold briefly. Gradually release the pressure of the right hand to assess if there are some abnormal findings in the patient's kidney. Repeated steps 84 to 87 for the left kidney. This is to assess the left kidney. Palpated the kidneys. Begin palpating at the symphysis pubis and move upward and outward to estimate bladder borders. To know if there are some abnormalities at the patient's symphysis pubis and estimate the bladder borders. Noted for consistency and tenderness. To know if the symphysis pubis of the patient has presence of consistency and tenderness. Okay. Perform hypersensitivity test. Stroke the abdomen in the sharp object, example broken teeth applicator or tongue blade, or grab a fold of your skin with your thumb under the index finger and quickly let go. To assess if the client can feel the pain and other abnormalities, repeat step 102 several times along the abdominal wall. This is to assess the abdominal wall. Noted for pain or exaggerated skin reaction, to know if there are some presence of pain and exaggerated skin reaction during the assessment. Noted for psoas signs. Ask the client to lie on the left side to ready the patient for assessing his or her psoas. Hyperextended the right leg of the client to assess the right leg of the client if he or she feels any pain when extending it. Noted for pain and reaction of the client to record if the patient feel pain and other reaction during the assessment. Tested for obturator sign. Held to supported the client right knee and the ankle to ready it for the assessment and to assist them for the test. Flex the hip and the knee and rotate the leg internally and externally. Noted for pain and reaction of the client to be able to know if the client feel any pain when rotating the leg internally and externally and have a record of the assessment and the result. Test for appendicitis. Assess for rebound tenderness by palpating deeply at 90 degrees of the abdomen away from painful or tender area. To know if the abdomen of the patient still in pain when it is deeply palpated. Suddenly release pressure. To assess some abnormalities, pain, reaction, and many more. Listen and watch the client's expression of pain. Through this, we will be able to know if the patient feel any pain during the assessment. Ask the client which hurt more pressing in or releasing. Ask the client where in the abdomen of the pain occurred. To know where are those areas that are painful during pressing and according to know the client later. Summary and closing phase. Help the client to put back his clothes and position the client comfortably in the bed so that the client will be comfortable enough and he or she ready to listen for the results. Ayan, Summarize the information obtained during the working phase and discuss findings to the client. Discuss with the client possible plans to resolve health concern if present, so that the patient will know what are the results in all the assessment performed and to answer all the questions and clarifications of the patient. So upon assessing the abdomen, it was all good and normal, and all of the results a while ago is all normal and good. So all you can do is that keep your lifestyle and your body fit and eat healthy foods. Okay. Okay. And when you feel uncomfortable, you are feel free to come back here for another assessment. Okay. Okay. Assess for the client's understanding of the plan and need for further teaching. Provide the client the opportunity to clarify, ask, raise any concerns, so that the client will be able to know if what are the things he or she will be doing after this assessment. And do you have any clarifications or concerns with this or feelings about the assessment? Okay. Thank the client who attended the interview politely. Done after care perform hand washing. To thank them for their cooperation and free myself from infection and cross-contamination. So I just want to thank you for your cooperation. Okay? Document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.